think I jumped out of too many airplanes when I was in the Army, and part of that
I could
time was
not
injured.
get underneath the trellis wire or the drip line. It would cause a lot of pain.
Over the years, the pain just got worse and worse and worse, and it got to the point where it was almost unbearable to ski all day.
And I'd be standing on my knee for an hour or 2 hours, and I would be nearly in tears.
I like to walk the golf course, and so when I couldn't walk the golf course, it was time to do something about it.
It's remarkable that in just 28 minutes, with the assistance of a Mako robot, that lives are changed. I've been amazed at how we have brought back vibrance to individuals who have lost their ability to enjoy recreation and to take a walk and enjoy life at its fullest.
Robotic surgery allows us to apply the technology of modern computers and that accuracy to the human body for the first time.
The robot allows us to reconstruct a three-dimensional model of the patient's knee before surgery, allows us to essentially plan the key components of the surgery before they're actually performed.
You can't make a mistake because of the brakes and the passive robot arm prevents all mistakes. So you're creating a virtual room for that robot arm, making it extremely precise. It's the most precise surgery that we have to offer.
Because we don't cut the muscle, this allows for more rapid recovery, more easily gaining the flexion after surgery, and less pain and less blood loss.
The level of risk around these surgeries is so much lower than the traditional approach to knee replacement surgery.
Modern pain management techniques have improved our results dramatically. We now use pain management techniques before the surgery, during the surgery, and after the surgery. This allows the patients to have much fewer complications, a much easier recovery, and so people feel much more natural and get out of the hospital within a day or so and get back to their normal lives much quicker.
It's been very clearly shown that the longer the wound is open, the higher the risk of complications. Because we do a very fast and efficient operation, we have a lower infection rate, a lower rate of blood clots, less swelling, and less pain after surgery.
He gets in and gets out in a hurry and doesn't cut the quadriceps, so you really are able to get around quickly.
I went in at 5 o'clock in the morning and left at 5 o'clock in the afternoon, an outpatient, which in itself I think is remarkable.
My rehab went so well that I was driving my car in 4 days, and I was flying my airplane in just a little over 2 weeks. I didn't feel restricted at all.
6 months after the surgery, in fact almost 6 months to the day after the surgery, I was back to the ski resort and ready to hit the snow and see how it was going to be with the new knee. I could turn, I had all the feeling, I never felt like it was any different than having both my own knees.
A lot of my friends have gone through this, and to see the miracle that has occurred certainly convinced me.
The work of Dr. Thomas Coon, Dr. John Valivas, Dr. Adam Friedhand is world class. These doctors are delivering some of the very best care that patients can receive in any setting worldwide.
I do anterior approach total hip replacement. The anterior approach does not split any muscles, does not divide any nerves. It allows us to give people a hip that they're going to recover from more quickly, have less pain with, and ultimately a hip that's going to feel more natural.
We've assembled a world-class joint replacement institute here in the Napa Valley. Our collaboration means that we are able to provide the highest technology and the highest standards of care for joint replacement surgery.
These exceptional doctors working together have produced a platform that delivers care here in the pristine Napa Valley in a manner where patients are receiving the very best in joint health that the world has to offer.
And we're able to offer our patients the best possible outcomes and technologies, the latest in computers and robotics, right here at St. Helena Hospital.